Welcome, everyone. My name is Stella Go, and I'm the convener of the Philippine Migration Research Network and a Humanities and Social Sciences faculty member at De La Salle University in Manila. Thank you for joining us in today's Migration Dialogues webinar on Migrants in the Frontlines, the state of Filipino healthcare workers in the United States. This is the sixth of a series of migration dialogues since April 2020. The first webinar held in April focused on the impact of COVID-19 on the overseas Filipinos and their remittances and how government should address these impacts. The second, held on May 13, featured Filipinos who were working, studying, and residing in the United Kingdom and their situation vis-a-vis the current global health crisis. The third in the series, held on May 25, shed light on the state of Filipino seafarers amidst the COVID-19 pandemic. On June 16, the fourth webinar focused on the challenges of return and reintegration of overseas Filipino workers who were repatriated as a result of COVID-19. On July 23, the fifth Migration Dialogues webinar went regional and looked at the future of international migration in the ASEAN in the light of the current global health crisis. This webinar is brought to you by the Philippine Migration Research Network, or PMRN, with the support of the Philippine Social Science Council, or PSSC. PMRN is a network of individuals consisting mostly of social scientists and other professionals that was organized to advance knowledge and understanding of national and international migration trends and developments. Meanwhile, PSSC is a nonprofit organization of professional social science associations and social science research and instructional institutions. It acts as the secretariat of the PMRN. Without further ado, I am pleased to introduce our moderator for today's webinar, Dr. Renzo Ginto. He is the Chief Planetary Doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet. An Obama Foundation Asia Pacific leader and an Aspen Institute New Voices Fellow, Renzo received his Doctor of Public Health degree from Harvard University and his Doctor of Medicine degree from the University of the Philippines, Manila, under the Accelerated Integrated Liberal Arts Medicine, or InterMed program. He previously served as consultant for the International Organization for Migration to help establish the Migrant Health Program of the Department of Health. The offshoot of this work of Renzo is the establishment of the Philippine Migrant Health Network, a multi-collaborative network of government agencies, civil society organizations, the academe, international organizations focused on promoting and protecting the health of migrants and overseas Filipinos. Without further ado, may I present to you Dr. Renzo Ginto. Renz, take over the floor.
Thank you very much, Stella. And it's really great to be working with you again after several years. And I'm really glad that the Philippine Migration and Health Network is still very much alive and kicking, especially in this day and age of COVID. Thank you also for this opportunity for me to moderate this important webinar. Thanks to the Philippine Migration Research Network for this privilege. And today, the COVID-19 global pandemic, as we know, has deeply affected our lives. As we speak today, there are more than 22 million cases of COVID-19 worldwide, with the United States still the epicenter at 5.5 million cases. And the Philippines, on this side of the Pacific, the top notcher in Southeast Asia with more than 174,000 cases. As we grapple with this public health crisis, let us take a look at one of the heavily affected sectors, and that is the sector of healthcare. Healthcare workers all around the world are regarded as heroes for having been standing in the front lines in this battle against the unseen enemy that is the coronavirus. In the United States, Filipino migrants have been helping in these front lines. And that's why in the sixth session of the PMRN Migration Dialogues, let us learn more about their situation, the roles that they play, the challenges they face, their coping strategies, and the kinds of support they are getting from the government and the Filipino community and organizations. So this webinar will bring together Filipino healthcare workers working in different hospitals and healthcare institutions from the East Side to the West Coast. And let me now introduce our research speakers for this session. Our first speaker is Dr. Mary Joy Garcia Dia, the current president, the 21st president of the Philippine Nurses Association of America, where she launched the Heal Our Nurses campaign as part of the COVID-19 Task Forces Initiative on April 3, 2020. She is also the program director of nursing informatics at the Information Technology Department of New York Presbyterian and the board member of the Health Information Management System Society, New York State chapter. Our second speaker is Dr. Reynaldo Rivera. He is the Director of Nursing Research and Innovation at New York Presbyterian and Assistant Professor of Clinical Nursing at Columbia University School of Nursing, both in New York City. He is also an Associate Professor of Nursing at Francis Payne Bolton School of Nursing at the Case Western Reserve University in Cleveland, Ohio. His research and contributions focus on nurse engagement and practice innovations, including nurse residency programs, academic practice, collaboration initiatives, mentoring, narrative nursing, appreciative inquiry, use of liberating structures, and enhancing professional governance. Dr. Rivera is also a former president of the Philippine Nurses Association of America. And later, they will be joined in a very interactive and dynamic panel with Nurse Janet Mary Rodriguez Cuekong. She's currently a nurse manager at Mount Sinai West Telemetry and Inpatient Rehabilitation. Before working at Mount Sinai, she had progressive responsibilities at the New York City Health and Hospitals Corporation, including Director of Quality Management, MDS and Admissions, Associate Director of Ambulatory Care, and was previously the Director of Nursing of the Skilled Nursing Facility. Currently, she is the President-elect and Treasurer of the Philippine Nurses Association of New York. And we have also, from the other side of the United States, Mr. Jeff Encinas. He's been working as a registered nurse at the Stanford Hospital and Clinics in California for many years. He's an endoscopy nurse. So welcome again to our esteemed panel, and thank you for joining us from the other side of the world. We invite our viewers to join the discussion by writing your questions and insights in the comment section of this live video. And we will have an open forum towards the end of this webinar. So we really are looking forward to your comments and questions. So now let's begin. And we'll start with Dr. Mary Joy Garcia Dia. Mary Joy, can you share with us, the efforts of the PNAA, the current situation of the Filipino American nurses, and how is PNA providing assistance and help to these nurses, especially the ones affected by COVID-19? So Dr. Mary Joy, please take it away. Thank you.
Thank you so much, Renzo. Magandang umaga sa inyong lahat and greetings from New York. It's evening here, but we are so glad to participate in this discussion. Let me take you back to the time when COVID was really just beginning here in New York, and that was sometime towards the end of March, early April. And this is where we realized that we need to create a PNAA task force, and we call this Heal Our Nurses campaign. So I will walk you through on what was the experience of PNAA at the time of the pandemic, and also what were the things that we did in collaboration with our chapter presidents, where we have over 55 chapters in 43 states across the United States. And these are the leaders that have formed the task force together. And at that time, I was the president-elect of PNAA. And our dear President Madeline Yu, unfortunately, also got sick, and I had to take over temporarily. So you can imagine the emotional distress that all of our chapters and members were experiencing from March to April. And what we wanted to find out from a membership perspective is really understand what's going on in the different areas like New York, New Jersey, Michigan, where there's really a surge of COVID. We want to gather information on our members who passed away and who were sick. From an organizational perspective, we wanted to understand the stories and the reports with regards to the shortage of PPEs, the surge of patients where it's really so hard to take care of so many patients, and stories of nurses saying that it's something that they have not experienced in their years being a nurse. And how can we create recommendations for PNAA? And at the same time, evaluate the impact of COVID to our community, most especially to our families, and also understand what's the impact of the pandemic on our public health, our policy, and future of nursing. So just to give you a background of the distribution of nurses here in the US, there's approximately 3.8 million nurses, around 160,000 Filipino Americans, and out of that, there are at least 8,000 PNAA members, which are both active and inactive. And this is a distribution of our members all across North Central region, South Central, Western, and Eastern. And as you can see here, the Eastern region has the most number of members. And we also wanted to understand what's the specialty that our members are in, because from my point of view at the time, what are the most immediate need? So as you can see here, a lot of our nurses are working on the front line. There's at least 4,433 where they did not identify what their specialty is, but you can see that a lot are working on the acute care, urgent care, and emergency care areas. And that's where the burden of the intake of patients that's continuously surging in our hospitals. So based on the anecdotal reports and feedback from our chapter presidents, a lot were undergoing helplessness because obviously we have to consider the lack of PPEs. People are just trying to get supplies all over the place, and we have to kind of like understand what are the other trauma that these nurses are experiencing. They're fearful of bringing COVID to their family. They're also concerned of their health, especially have comorbidities like hypertension, asthma, and diabetes. We wanted to know what kind of programs are out there, so this way we could provide support for our members and also look at the diversity and inclusion, because obviously there are some components of racism associated with the pandemic. And we wanted to understand from a long-term perspective, what will be the impact, especially to our nurses that might be wanting to retire, or even our young nurses that might want not to continue nursing anymore. So this is where our situation during the time when the COVID was really peaking here in New York. As you can see here, there were around 25,000, over 25,000 cases reported. And this is a comparison of reports submitted to us from the different chapters all across the US. So you could see state of New Jersey, state of New York were really, really surging. And at the same time, these are the chapter initiatives that people were just doing. There were like appeals for PPEs that's being sent to the legislative committees. Chapters were writing to the legislators. A lot are also doing mass donations. In fact, some of our members are sewing their own mask. People are just helping to deliver food. And of course, there's also fundraising, and a lot of educational campaign and prayer groups were also formed just to provide spiritual support to each other. At the same time, there were also hospital measures that's reported state to state on what's going on. And what's worthy to take note on this graph is that there is an increase with the virtual visit and telehealth, obviously because of the contagiousness of the disease. Also hospital measures that's reported state to state on what's going on and what's working. So at that time, our priority was really to focus on working with our nurses. How do we help them? There was a lot of mass donations. These are nurses where I work in New York Presbyterian, where we were able to deliver meals to them. And at the same time, other chapters were just trying to create care package to make them feel that they're taken care of, because they're so tired, they don't have time to rest. And of course, we wanted to look at the priorities. What are we doing as leaders? What are we doing at the chapter level? So aside from our mask, our nurses drive, there were also letters of support and sympathy that people were getting. But at the same time, from the national level, we wanted to focus on the intermediate programs that we could create for our members, especially on how can we manage the next pandemic, and long term, how can we increase awareness in preventing the spread? Because obviously, even though we try to tell the public, please stay home in order for you to be protected, there are still some confusion on what's going on. So from May to June, we were able to provide masks to our nurses. We also made sure that these are going to extend the life shelf of the surgical mask or N95 mask that they have. That's why we opted for this cloth mask. At the same time, some of our members have expressed their own just sympathy to our nurses. And this is one of our members from North Carolina where she drew women with masks. And this is really a story from New York where one of our members sent us a letter of gratitude. And I want to read this to you. It says, "Greetings from a COVID-19 devastated city of New York. I was teary-eyed when I received a pair of masks from you. This represents and symbolizes sisterhood in times of critical needs. I can't thank you enough. I work at SUNY Downstate Medical Center, Brooklyn, New York. Our hospital was designated by our dear Governor Andrew Cuomo as a COVID-19 hospital. It was an overwhelming experience as a registered nurse taking good care of afflicted patients. And at the same time, you see deaths around you as I perform the duties I sincerely committed to do. Again, I thank you for those hands that sewn this mask. God bless your hands, your soul, and most importantly, God bless your heart." And this is really very, very profound. In addition to those emails, we also received cards of gratitude. At the same time, we wanted to push all the information. What are the resources that's available? PNAA is an affiliate organization of the American Nurses Association. So we updated our website to make sure that resources from ANA are provided to the members. We also started fundraising campaign for our members through our Ways and Means and through the help of PNAA Foundation. Other Filipino groups from the Filipino Googler Network reached out to us, and that was really comforting. At the same time, our education chair through May Guzman, together with some collaboration with the foundation, sponsored the COVID-19 educational series, similar to what the Philippines were also providing. And we encourage people to look at the website, so this way they could access these great applications, like such as the well-being initiative, mindfulness exercises. And we are also looking at the long-term effects of the virus. We wanted to reach out to members and really understand what's your urgency index. How does the stress right now affecting you and how you function at work, how you interact with your family? What are the things that you do to recharge yourself? And from PNAA level, what kind of workshop can we offer to our members? So this way they could be an effective steward and also do self-care. So this way they could be a better caregiver for other people. At the same time, we wanted to understand the research initiatives that's going on, especially in evaluating programs that will really work for us from a cultural perspective. So this way we can retain and recruit our nurses. And these are some of the stories that we have received from our members. This is a way for us to understand what's going on. Some have opted writing poems, so this way they could express themselves. And some of our leaders, our past PNAA presidents, have also offered letters of reflection to show emotional support to our members. And we created a video to the help of our communication and marketing chair, Carol Robles, and we posted this in our social media because we feel that this is our way to reach out to one another, especially with the limits of social distancing and the quarantine that's going on. At the same time, through prayers, when our dear president was sick, and at the same time, her husband was also hospitalized, who eventually passed away. This was such a devastation to our organization. And we united together, praying groceries, and also doing prayer rallies all across the chapters. And from June to the present, we know that we need to continue fighting and flattening the curve of this virus through our research co-chair, Dr. Danet Bloom and Dr. Emerson Ia. We were able to submit a grant proposal to PCORI. Unfortunately, we received news the other day that we were not selected, but we will continue to submit more grants to the NIH. And that's the spirit that we want to portray to our members. On the other hand, we were able to collaborate with the Asian Pacific Islander American Health Forum in another grant through the CDC, where we're trying to create training contents that would be culturally and linguistically applicable to Asian Pacific Islander communities, Filipinos, Koreans, Chinese. So this way, people can have a better understanding on how to follow CDC guidelines. At the same time, we were able to collaborate with the National Coalition of Ethnic Minority Nurses Association and contributed to a paper in the Journal of Transcultural Nursing. So this way we could share how do we take care of our population during the COVID pandemic. Again, our chapter from PNA Tampa showed their appreciation in Facebook once they received the face masks, and we were really grateful for that. At the same time, other groups like the Shield the COVID Frontliners donated face shields to our frontliners in Arizona, California, Texas, Florida, and parts of the North Central region. So we continue to fight the battle. I got inducted as the 21st PNAA president. Obviously, I have to step down as the chair of COVID, and now it's Dr. Jenny Aying who's taking care of this. But we know some of the lessons that we learned, that data is important. It's important for us to reach out to our members and really show what's happening. So as you can see here, this was at the start of the report on March 30. There was not a lot of surge yet, but right now they're still surging in other parts of the country. One thing that's really important to keep in touch with our members, we were able to provide weekly reports through our email updates. And it's important for us to understand how are we reaching people through the insights and statistics that we generated from the social media. But we know that there's still a long time to go in trying to curb the virus, right? We're still battling it, and we're preparing for the long haul. We're preparing for another resurge. And this is why it's important for us, and I'm very grateful to everyone in the Philippines to allow for us to share our story, because this is important, especially as we are recognized as the most trusted profession here in the US. But at the same time, this is the year for us to celebrate the year of the nurse, and it highlights our perseverance, our resilience as a people and as Filipino American nurses. So thank you so much for allowing me to share our story.
Thank you very much, Mary Joy, for that very comprehensive and inspiring story from PNAA and the Filipino nurses. I heard from you: reflect, recharge, retain. I love the triple R framework that you've laid out for us. Now, speaking of recharging, and I really appreciate, Mary Joy, that you highlighted the psychological dimensions of the COVID-19 pandemic, especially for our healthcare professionals, our nurses. May now call on Dr. Reynaldo Rivera, who will be sharing with us his study about psychological distress, coping behaviors, and preferences for support among New York healthcare workers, including the Filipino nurses in New York City. Dr. Ray, please.
Okay, magandang umaga sa inyong lahat. At magandang gabi sa mga taga New York City. So, okay. So I do not have any conflict of interest to disclose. And I just wanted to start first introducing where I come from New York Presbyterian Hospital. New York Presbyterian Hospital is an academic healthcare system affiliated with two premier medical schools, the Columbia University College of Physicians and Surgeons and the Weill Cornell Medical College. We have 10 campuses and are located in New York and in Westchester. NYP and its affiliates are consistently recognized as leaders in medical education, groundbreaking research, and innovative patient-centered clinical care. A guiding principle at NYP is delivery of outstanding and safe patient care, and for our patient and our 50,000 staff across NYP and our affiliates. The results of the US News and World Report's 2019-2020 annual best hospitals were released 3 weeks ago, and New York Presbyterian is ranked number 4 in the nation and number 1 in New York. This is the 20th consecutive year New York Presbyterian is the top-rated hospital in New York. We are deeply proud that the commitment of our doctors, nurses, and staff has been recognized across the nation. And in particular, I want to thank the nurses for their courage, dedication, and commitment to our patients, their families, and the communities that we do serve. So this is my objectives for the discussion today. It will be brief. I'll discuss the psychological distress, coping behaviors, and preferences for support among New York healthcare workers during the COVID-19. I'll describe as well the different strategies that we utilize to support our frontline workers. And I'll describe the lessons learned during the COVID-19 pandemic. As you know, coronavirus 2019 or COVID-19 is a global pandemic characterized by acute respiratory distress syndrome, and the dire consequences of this global pandemic have been difficult to escape, let alone ignore. COVID-19 symptoms may range from mild or no symptoms to severe illness. From March to May 2020, New York City is a global epicenter of the pandemic, with more than 180,000 confirmed cases. At the height of the pandemic, hospitals were reconfigured to meet the demands of patients with COVID-19. I remember when during the height of the pandemic, we have about 2,500 COVID patients admitted with severe conditions and about 750 ventilated patients. But now it's down to 15 ventilated patients. That's great. But yeah, during the pandemic, there were many people died, but we also saved many people. As of today, Renzo spoke about globally, there's almost 22 million COVID-19 cases and more than 782,000 global deaths. In the US, we have more than 5.4 million COVID-19 cases and 172,109 deaths. In New York alone, there's 426,000 confirmed cases and 32,000, almost 33,000 deaths. And majority of the deaths in New York is in New York City. Our study was published in General Hospital Psychiatry last June 2020. This is truly a collaborative study among physicians, medical residents, fellows, advanced practice practitioner, PAs, physician assistants, and nurse practitioners, nurses, psychologists, psychiatrists, and researchers. It took a village to form this research team, and thanks to Doctors Marwa Abdallah and Ari Schechter for leading this team. Let me go to the background of the study. The mental health toll of COVID-19 on healthcare workers is not yet fully described when we did this study, and many healthcare workers have been redeployed to areas outside their usual clinical specialty and or expertise, and may be working extra shifts or longer hours in order to care for COVID-19 patients. As you all know, COVID-19 is highly infectious. Healthcare workers are at increased risk for acquiring and potentially transmitting the disease to patients, co-workers, and family and friends. Healthcare workers are facing unprecedented amounts of COVID-19 related psychological stress across professional and personal domain. As you know, there's a cross-sectional study of Chinese healthcare workers found that more than 50% reported depression and 70% reported distress during COVID-19 pandemic. In New York City, death by suicide has already been reported during the time that we were doing this study in frontline providers taking care of patients with COVID-19. Unfortunately, we have one physician who committed suicide during the height of the pandemic. It was on the news in the United States, and that was really very depressing. The study investigate the sources and distress of that healthcare workers are experiencing at NYP in New York City during the COVID-19 pandemic. So we will discuss their current coping behaviors, the wellness resources, and they believe may help. So in terms of methodology, it's a cross-sectional online survey. It was conducted on April 19 to April 24, 2020 at a large medical center in New York City. And what I'm presenting to you is a preliminary report, if you will, and there are more studies to come that we are doing right now. This is this is a longitudinal study that we will doing actually. The instruments are demographics and risk, and we asked, demographic, and we asked their recent clinical roles. There was a brief psychological screen for acute distress disorder, depression, generalized disorder, loneliness, and sleep duration and disturbances. We also did an assessment of distress due to COVID-19. At the time, there were no COVID-19 specific validated questionnaire assessing distress. So we developed an instrument based on the consensus from interprofessional group of providers, supplemented by review of literature regarding COVID-19 related sources of distress. And then from there on, we have three categories that we did: national policies and guidelines regarding COVID-19, family and concerns outside the clinical environment, and personal and clinical work environment. And also participants also had the option to describe other stressors and concerns. We also look at meaning and purpose as part of our survey, coping behaviors, and potential wellness resources desired by healthcare workers. Let's look at the demographics. By April 24, 2020, we have 974 enrolled and began the survey, but only 657 completed all survey questions. It was an 11% response rate overall at the height of the pandemic. So, that's, understandable. There were 313 nurses who responded to the survey, 47.6 of the total, and mostly work in the ICU, which was 39.9%. We compared the ratings of sources of distress between those who completed the survey and those who began but did not complete the survey, because sources of distress were presented first in the survey. Now, majority of the respondents are from age group of 25 and 34, about 47%, and predominantly are women. 70.9, and comprised mostly of white people, 59.6. There's about 14.3 Asians. Majority of them are Filipinos, I'll say. And this is the most important slide. This shows the sources of distress due to personal and clinical work environment, family and concerns outside clinical environment, and the national guidelines and policies. 74% of participants reported that concerns about transmitting COVID-19 to family and loved ones was highly distressing. And over 60% rated concerns are highly distressing in terms of the health of their family and friends, maintaining social distancing from family, the lack of control or uncertainty, and uncertainty about colleagues' COVID-19 status. You will hear that in our discussion later on. With regards to the national shortage of personal protective equipment, testing, and the lack of national guidelines from regarding treatment of COVID was also highly distressing to people. Okay. The large portion of participants screened positive for psychological impacts of COVID-19. As you could see, all of this stuff, nurses, nurses and advanced practice providers, which is our nurse practitioners and physician assistants, we have to collapse them together, were significantly more likely than attending physicians to screen positive for acute stress disorder, depression, and anxiety, and they were all statistically significant. The other finding, nurses and advanced practice providers reported the worst sleep problems and substantial loneliness among groups. We have another analysis that we're going to publish on this, and hopefully we'll present it at the International Council of Nurses. There are no significant group differences in terms of the sense of meaning and purpose. This is interesting. 61% of all participants reported an increased sense of meaning, purpose during the time of the survey. 85% of the participants reported engaging in at least one type of coping behavior to manage stress. They love physical activity. They love to talk, yoga and meditation, and faith-based religion or spirituality was 23%. I'm just wondering if we conduct this in the Philippines, maybe number one will be the faith-based religion or spirituality. We'll see. Sorry. The next is the preferred wellness resources. The self-guided counseling with access to therapists is number one. And then the other one is individual counseling therapy, online clinician support group, and mental health wellness video, and online general wellness group were the preferred wellness resources. We have another study on how we supported, not study, publication, on how we supported our frontline workers during COVID-19 pandemic. In this slide, okay, you'll see how NYP mapped the employee journey during COVID-19. Our overarching goals were to keep employees informed about the latest developments of this evolving crisis and to protect their physical and mental health, to address employee needs in a time of social distancing and widespread disclosure. We expanded, adapted, or added multiple services. We provided daily video updates, email, and hotline numbers. Our CEO and president, we have huddles every morning and discussing of what's going on. So we keep abreast of what are the different changes and available resources for us. The physical and mental well-being, as well as the safety of our employees, are very important to us. We provided backup masks, COVID-19 testing for our employees, work health safety is available for them 24 hours. We waived co-pays. We provided virtual and well-being coaching apps, extra paid leave, online psychiatric assessment tracking. We have the symptom tracker. You know, if you have some issues, and you could download in your app. We provide pastoral care, bereavement support, and memorial services where for people, especially to those employees whose loved one died due to COVID-19. We have some employees who died during the COVID-19. In terms of workday journey, we provided child care support to our employees, support care time. It's for 1 month. We gave them support care time. This is excluding our leave of absence, our sick time. So we provided another month of support care time. Remote work or work from home. We provide bonus for frontline workers. Remember, the pandemic has a toll not only on our psychosocial, emotional well-being, but financial as well. We gave them about $1,250 times 2 during that time. COVID support care fund was also instituted, especially for our support staff. What else? Bereavement support and benefits, which I discussed earlier. Housing and hotel hotel rooms were given to them for free. We provide free parking, rental care, free on-site meals for breakfast, lunch, and dinner. We gave them recharge rooms stocked with snacks, soothing music, and TVs displaying notes of gratitude from the community. And most important thing is we provide them daily scrubs. So they come to the hospital, they change their clothes, we gave them daily scrubs, right? And then when they go home, they you know that they leave their dirty scrubs, and then so when they go home, they feel that they're free from germs when they go home to their family. And again, this is the schematic diagram on when we implemented the many intervention that I mentioned from the previous slide. Okay. Lessons learned. One is a bidirectional employee-employer communication strategy is imperative. We need to manage the continual developments and evolving employee policy and service changes, as well access to available resources. We allay the anxiety of our employees, listening to the needs of our staff. Transparency is essential. And then leadership matters. We need to align, we need to be agile, we need to zero in on what really matters to our employees. People need to know that the leader cares for the employees and understand what they're going through. Accountability at all levels is imperative. Adherence to the best practices, as I said before, it is about the safety as well as physical and emotional well-being. Collaboration is key across small decision-making groups. The crisis has inspired an unprecedented sense of community and collaboration. Rethinking the work environment demands virtual employee services. You may be out of the office, but not out of work. So that's good. Some of them, if they could work from home or what we call telecommuting, then we gave that. The spirit of volunteerism made many services possible. We are all in together to combat this pandemic. So on a final note, a quote from Johnny Corn: we have a chance to do something extraordinary. As we head out of this pandemic, we can change the world, create a world of love, a world where we are kind to each other, a world where we are kind no matter what class, race, sexual orientation, and what religion or lack of, or what job we have, a world we don't judge those at the food bank because that may be us if things were slightly different. Let us respect, love, and kindness be our roadmap. So these are the references for my talk. This is one study that we did in terms of the rapid critical training of nurses in the surge of the coronavirus. We also look at the innovative ICU physician care models. We have a lot of volunteers and of physicians who are working with us during that time. So we have a different model. And then there are the other studies that I discussed today. So thank you. This is my dog, Molly, and I want to hear from you. My email is rrr9001@nyp.org, and you could tweet through RR Rivera 1. Thank you.
Thank you very much, Ray, for that very comprehensive presentation, not just about your latest research, but the range of services that New York Presbyterian are providing our frontliners. I'm not sure if you know this, joke or this, saying now here in the Philippines among millennials, sana all, we're wishing that everyone can actually have access to those kinds of services. And unfortunately, that's not the situation. Later, we'll have a much deeper dive into these, inequalities and disparities, access to mental health, to even transport services, even to funeral services, as you mentioned a while ago.
Yeah.
So now I want to bring in Janet and Jeff, representing both sides of the United States. to actually, tell us more stories. We've heard from Mary Joy and Ray, the statistics, the big picture, what's the situation. But I want Janet and Jeff to bring us into, the healthcare facility, the ICU, the emergency room where the COVID suspect cases are being brought. Uh, what is the situation now on the ground? And how are Filipino nurses in particular, confronting the challenges that Dr. Ray and Mary Joy mentioned a while ago? So maybe we can start with Janet first in New York.
Hi, good evening and good morning. Basically, right now, our status had really, really tremendously like a 360 degrees. We still have one or two COVID, but we're screening everybody. But during the first 2 week of March, that was a height we're in. Getting in an alert that we're getting a patient, everybody into like a panic mode, or nurses. Filipino, I have a lot of Filipino nurses in all shift on my two of my units, and of course the anxiety, the fears during that time. But now it's different. We're kind of back to normal, but of course with social distancing and wearing the mask. But let me take you to the time when we were alerted that we will be getting our first COVID patient, and most of my staff were really, really scared, and we don't know, we're not ready to take in this patient, and kind of anxiety. There are a lot of anxiety, and they're very anxious. And of course, our PPEs are one of our focus, because we need to make sure that I know how to take care of myself. I know how to protect myself. So as my staff to take care of themselves. So, um, day to day, during the peak of that first first two cases we have, I got sick myself, and my assistant, who actually was documented the first RN who died during the COVID-19 pandemic during on the third week of March. So I was very confronted with my own, grief, and how are you going to be coping with all your staff being out, being sick, and the grief of losing someone dear to you, close to you. You work every day, and my kind like, my bodyguard, my kind like my assistant. So I was really distraught. But you know, you set aside your own feelings because you're gonna take care of others. You have to take care of your own staff, and pick up the phone, calling one by one, trying to connect with them, trying to ensure that they also worried about their own health. They're also worried about coming back to work, how they're going to get paid. There's no doctors, how they're going to get tested, and so forth. So as a nurse manager, I was trying my very best to ensure that I was there for them, even though I was still not up to par because of my own grief, as I mentioned to you, having lost someone dear to me, was really critical. And but also for them to hear that there was somebody that they could go to. I became their therapist. I became their close friend, their mother, their sister, their daughter, for most of my staff. So we also had an episode wherein we're running out of beds. We're not able to. We have to very quickly find an avenue wherein we're gonna move patients from ICU so that they could take in patients from the ED. So we converted our RE2 area, a rapid evaluation unit, which is a 4-bedded room, to a negative pressure unit. And as you see these nurses engaging, taking care of very, very sick patient, um, you just coming in to check all of them, and all of a sudden, once you turn your back, you're just calling rapid response team, medical code left and right, and you will just see the faces of these nurses, one after the other. One, they just finish a code in 5 minutes, another one is coding, and then the next thing they're packing the body of the patient. So it's really, at that time, was really a very stressful situation. But with the grace of, with a lot of prayers, a lot of support, we're able to cope. We were able to, uh, we're saying that we are in this together. So we kind like a lot of group prayers, a lot of support, one-to-one. A lot of people help anywhere else. And by writing our narratives, our telling our stories, our support system, our family members, we're able to cope. We're able to cope during this time. And but of course, there are nightmares. There are some of my nurses still unable to get through, and some of them actually move away to New York. Just recently, I have 8 people leaving my area due to retirement, moving away, and leaving bedside nursing. I'm also contemplating of leaving bedside nursing, but it's another story. But it's kind of like it's a lot. But I'm so glad that we were able to share this story to you guys. And as I've said, telling how difficult and how you get through it in one day at a time, and of course a lot of prayers. Thank you.
Thank you, Janet. And wow, that is a very powerful story that you just shared. You mentioned a while ago, you learned how to set aside your feelings. And, we in the healthcare professionals, we were taught that, when we were studying in nursing school or medical school, you can still remember the first death of your patient, right? But this time we're talking about something different. It's a death of a colleague who got ill because of a pandemic, and perhaps that is unprecedented. We've never had an experience trying to become even our therapists and counselors to our colleagues because of the grief and really the suffering that the pandemic has brought to us. Now I want to go to Jeff, and he's working, as I've said a while ago, in Stanford Hospital. Again, another very well equipped and advanced, technologically advanced, very prestigious hospital network in California. Can you tell us the situation there, and how are the Filipino nurses coping with the challenge?
Um, Good morning or good evening to everyone. At this moment, we're the epicenter of in the United States of COVID. Most Filipino nurses that I work with, we're okay. We're doing fine. It's kwentuhan. That's when we how we de-stress. Um, Before the pandemic started, I was actually on medical leave. But when it started hitting the United States, I knew that I was going to be needed. So I convinced my doctor to release me so I can help with the fight. So the first month was a freak out moment for everybody. Everything that we were taught in nursing, or everything that we were doing before, like the N95 mask, you can wear them for 3 days. It was supposed to be worn for each patient. Those were scary moments. And I belong in the interventional platform, so we do bronchoscopies, we do IR procedures, we do endoscopy procedures. So most of the time, we go where the COVID lives, in the lungs. When we put in the tracheal tube, we actually, trying to invite the virus. Coping wise, we actually, I had like 3 known exposure events, so I was tested like numerous times for COVID. That's the most stressful part. Letting your family know that you might have it, and then coming home and living in the garage for like 2-3 days, because you don't want them to be infected if you have it. Otherwise, we're hanging in there.
Thanks, Jeff, for your your sharing, and you reminded us about this concern. It's not really just about us health professionals,
Mhm.
but really the danger that this also brings to our families, and not just the physical danger. You know, you might inadvertently and unknowingly bring the virus, for example, back to
Yeah.
your home after working, but also the emotional component. You know, just the idea of informing your relatives about the possibility. It's not even confirmed yet. That
Mhm.
I'm imagining a very excruciating experience. Now I think let's bring in back Ray and Mary Joy, and let's have a few minutes of discussion and try to, see, what are the themes that came out from all your presentations, but also your stories. And I have a lot of notes here. By the way, before I proceed, I just want to say hello as well to not just the members of PMRN tuning in, but also the members of the Philippine Nurses Association of America. I'm pretty sure you were able to bring a big gang right now listening to us. Special mention to my aunt Jennifer Aying that Mary Joy mentioned. She's my aunt and my tita in Boston when I was studying there at Harvard. So, this is important. The pandemic is happening on the 200th birthday of Florence Nightingale. The first nurse, the founding mother of the field of nursing. And that's why the WHO, the World Health Organization, announced 2020 as the International Year of Nurses and Midwives. And really now nurses are, in the front pages. You've been called heroes. But really, what we're also realizing is that health workers, especially nurses, the frontliners, we are humans as well. We're not invincible, and we see several of our comrades starting to be affected, if not killed, by this unseen coronavirus. And so, I think my question now is, how do you see the future of nursing? In America in particular, but also worldwide. And a while ago, Janet was saying there are some who are already considering to, shift to another profession. They leave New York. And I'm also worried not just about the current workforce, but also the young kids who might be listening. Initially they wanted to become a doctor, and I know, it's very Filipino. They're still 5 years old, and we already talk about some of them becoming nurses or doctors in the future. I wonder now if kids living in the age of COVID, the COVID generation, some of them might now be thinking twice, oh, I don't want to become a nurse or a doctor anymore because of the harms that maybe a future pandemic will bring to their lives and to their families. So any insights regarding that question?
Yeah, Renzo, I would like to answer that. So what we have done, we have nurse residency program at New York Presbyterian. The residency program is a year program for our new grads. And during that time, we did not cancel them. We continue our residency program to support our millennials, especially during this time of the pandemic, because there's a lot of apprehension, fears. So for us, for you to be, to build the resilience, you really need to support your workforce, and that's for us is very, very important. So you need to be agile, provide the support quickly, and that's the reason we did not cancel that for our new grads.
Right.
Yeah.
Anyone else?
I would
Mary
also
Joy,
like to add,
please.
um, even prior to COVID-19, across the US, they're already looking at the future of nursing campaign. So there are already measures in terms of like encouraging younger generations to consider nursing, and also looking at how do we increase nurse educators faculty that would have individuals like us. So this way we could role model and really portray the successes of nurse leaders choosing nursing as a profession. But obviously, it's a different reality now with what COVID has brought to all of us. And in fact, one of the webinars where we featured a young nurse and she shared her experience, she shared that even though she also suffered COVID and she was exposed, she will not change what her choice of profession is, and she will still continue to be a nurse, which is really
Yeah.
gratifying.
Right. So I think we can actually learn a lot of lessons from the experience in the United States, because I'm pretty sure you've also seen in the news from this side of the ocean that, you know, medical workers 2 weeks ago have called for a timeout. You know, they're starting to feel burnt out. We're being concerned about the potential collapse of the health system because, you know, we're not able to flatten the curve, and, you know, we've hit that horizontal bar in that classic graph. Hospitals are already announcing they've reached full capacity. And, you know, you hear also stories of nurses who didn't even see their hazard base being paid or reach their bank accounts, only for their children to realize, you know, it's a very minuscule amount. And so, you know, there's so much that we can learn in terms of how we can really support our nurses, even here in the Philippines, to, you know, make sure there's, you know, that interest and commitment is sustained throughout the pandemic and even beyond. I want to ask another question when it comes to, you know, these are interesting times in the United States, of course, globally, but in the United States, right now as we speak, the Democrats, and I will not ask you if you're for Trump or Biden, but the situation now in your country is, you know, there's an upcoming election. The Democrats are having their national convention now, and, you know, healthcare is really a big topic, a big election topic, you know, in the US before the pandemic and especially now. How do you see the nurses in general, but also the Filipino nurses in particular, you know, being an important force, you know, in this conversation, a positive influence in the transformation of healthcare in America, and to making sure that, you know, you overcome this pandemic sooner rather than later? Any thoughts? Jeff?
Being a science-based profession, I'm pretty sure most nurses and Filipino nurses will know who to vote for this election. We can clearly see what happened, why we are the #1 epicenter right now in the United States. Nothing was done when it came here. Nothing was prepared. We were totally state by state, we were left alone.
Anyone else? Thanks, Jeff. So the Filipino nurses know how to vote. that's very you know, promising and encouraging to hear. I hope every Filipino knows how to vote wherever you are in the world. And maybe share with us, you know, Mary Jo, I'm seeing your hand, you know, the PNAA's advocacy as well. Again, you're a vital force in American healthcare. The first, I think, one of the first ethnic minority nurses to actually, you know, form your organization. And I believe you're also part of the American Nurses Association. Mary Joy?
Yes. I think from a healthcare perspective, of course, we try to advocate that health is a basic human right. And obviously, particularly for our minority group, this is where we Filipino nurses have always advocated for community outreach programs and really trying to understand social determinants of health, issues of economics, issues of your own health literacy, how environmental factors could affect how you take care of yourself. And there are collaborations with other organizations like Kalusugan Coalition here in New York City, and also partnerships with other similar organizations that could really advocate for the health of the minority, particularly for Filipinos. So I think when you look at it in that regard, this is where the politics may sometimes come into play in terms of how do we address healthcare in general, and what are the policies that would be beneficial to our community.
I really like that, Mary Joy, that you reminded us that health is not, you know, a silo. It's not in isolation. It's definitely highly intertwined, deeply intertwined with, as you've said, the social determinants of health. And COVID-19 is a demonstration of that. As you can see, a health crisis has now upended, the economy, our way of life. Everything now is in Zoom, which we never imagined 6 months ago happening. And so health has become really a central in the social conversation. And for sure, we health workers, especially the nurses, and I like reminding us, nurses really, and I'm a physician, so not many physicians do think this way, that nurses should really be leading us in the transformation of healthcare in broader society. One, you're greater in number than us, right? Number two, you actually spend more time in the bedside than physicians. And so you really have a positive influence to our patients and to our broader communities. And we hope to see the rise of nurses in leadership, especially in this international year that was dedicated to you. I just want to bring now Professor Jean Franco from the University of the Philippines, and she's also the Deputy Secretary General for Research of the Philippine Migration Research Network. And this is important because Professor Franco is looking at the situation of Filipino nurses in America from the Philippines. That's her perspective. She's also a political scientist. And so maybe Professor Franco, Jean, what is this pandemic telling us when it comes to, the future of nursing migration, the future of healthcare, both in America, but also in the United States, hearing what you just, hearing what the other panelists have just mentioned about their experiences in the United States. So Jean, please.
Hi, good morning. Good evening sa US. Thanks, Renzo. This has been a very interesting and insightful conversation. And yeah, I think that's a very good question how will we move forward? My sense is that this pandemic has brought visibility to nurses and health workers, not only here in the Philippines, but in the rest of the world. And for a very long time, the work that nurses, health workers do were invisible, mainly because it's caring. And caring is usually not, quote unquote, seen as important and is usually undervalued because the idea is that it's a work that's quote unquote natural, especially for women. But I hope this visibility would translate into better working conditions, better pay, allowing them to express their plight, their situation, whether there's pandemic or there's no pandemic. So I guess we should watch out for the stimulus package that governments are going to draft, to formulate, to allocate. And I hope the increased visibility of nurses and health workers would translate into a more effective response in the short and long term for better working conditions for nurses and health workers all over the world.
Thank you, Jean, for your remarks. And indeed, I hope that this pandemic and the COVID-19 pandemic is definitely devastating, and it's really sad that we're seeing lives still being stolen, partly because of the virus and its complexity, but also, and I think more importantly, a while ago, I think it's Janet who implied on this, the failure of governments, of leadership to really act on the challenges that COVID-19 is revealing to us. And many of these challenges are also existing in the pre-pandemic era. I think that's also important, the lower wages, the demeaning conditions that some of the health workers are experiencing. These were not created by COVID. These were existing even before, unscrupulous practices of health facilities, especially the smaller hospitals, whether in the US or in America, again, these are problems that have been existing before, and then now COVID-19 is just magnifying it and reflecting it back to us. Hey, we still have unsolved problems, and now COVID-19 is exacerbating these challenges. There's so many questions from our Facebook, from our live stream, and I encourage our panelists to really be quick in answering some of them. One question is about nursing homes. We know that in the U.S., there are many nursing homes where the elderly and the chronically ill are being sent to, and a lot of the Filipino nurses and caregivers are actually working in these nursing homes. Some nurses actually own, Filipino nurses own nursing homes. And we know that if we don't put up the necessary protections, nursing homes can be petri dishes for viral infection. And we've seen nursing homes, a lot of the elderly, not just getting COVID-19, but also dying of COVID-19. What is the situation, and how are Filipino nurses addressing these challenges, again, in nursing homes? Anyone who can just briefly comment on that?
Hi, Renz, Janet.
Please,
So,
Janet.
I used to work in long-term care for a long time, and I was a director of nursing, but I know a lot of friends still in our dear Dr. Marie Ortaliz, actually from PNA New York, president, delivered some of the PPEs to the nursing homes because they were having difficulty getting or challenges getting some of them, and PNA NY had distributed with alongside with the other donations that was received to the nursing home, especially those nurses working. I know the condition were grave at that time because it was really difficult for their patients also to be in and out between the hospitals, and they're really number one who's going to suffer because of the condition of the elderly. But they're also making sure these nurses, you know how nurses are having 2 triple jobs, and it was a hardship for them at that time because once they know that you're working, then you're not supposed to work on another job. So it was really difficult at that time, and I know, and the testing as well, and there was more rigorous regulation for the nursing homes or the skilled nursing facility, and they're now being tested weekly just to ensure that the patients will be safe. And there's more regulatory. They're scrutinized by Department of Health, the State Department of Health. They're all in a nursing home almost every day, and we have a lot of our officers in PNA New York that is also director of nursing, and really telling us that they're really strict in regulation about infection control.
Thanks, Janet.
Yeah, things have changed.
Ray.
Yeah, now because of it's highly regulated. Now they have a lot of PPE available for them, so which is great to know.
Thank you. And there's several questions regarding, hazard pays or additional COVID benefits or wage supplements as a result of the pandemic. I think they were all encouraged by Ray's presentation of what the New York Presbyterian is providing to their frontliners. I guess the question there is this something unique to New York Presbyterian? Is it something universally applied? How about the smaller hospitals where we suppose a lot of the Filipino nurses are also working in or employed? And what's the role of government here? Is there supplementation provided by government, or is it all being assumed, by the individual hospitals? Anyone? Jeff from Stanford.
I think that's just in New York, because we don't have that here in California, and we actually experienced. We were threatened with furlough or forced vacation because we actually stopped elective procedures and elective surgeries to accommodate the surge that we were waiting for. So it was like a slap in the face that, you know, you were here during the pandemic and were waiting for the surge. And since it did not come when they expected it, you were asked to take a vacation or leave of absence so that the hospital will not lose money.
Any other thoughts on that question about, what I'm getting from Jeff is there seems to be some variability. Some hospitals are providing more and some are providing less. Or maybe how, for example, PNAA is advocating for more benefits and care given to our frontliners. Mary Joy or Ray or Janet.
Yeah. So I think it's dependent on the healthcare system, depending on the resources that they have. Of course, PNAA would always advocate what is appropriate for our nurses. There are also union of nurses, like the New York State Nurses Association, California Nurses Association, that represents from a labor perspective in terms of like addressing this type of hazard pay. We are kind of like neutral in that situation because our organization is focused on the professional advancement, but at the same time, we support whatever is appropriate that would benefit our nurses. And we would listen to them. We would issue position statement as needed in order to support our nurses in that regard.
Yeah.
Thank you.
Renzo,
please.
leadership matters, right? So it depends on how they, you know, what is important to your employees, and that's very important. That's critical. So with us, we move our, yes, we did the same thing, Jeff. We close our OR, you know, all of those, our clinics were closed, but we mobilize. That's part of what I did, mobilize all those people to help to help our nurses at, you know, during the surge. So we move them, we give them training, and then to assist, you know, so that there will be no changes in their salary. So that's what we did. You know, we move them, yeah, because rather than, you know, not give them the money, we did give them the money, but they work in other places in the hospital. So for several weeks, that's what I did, deploying those nurses to assist our other nurses, because we doubled our ICU. So for example, if you have 50 ICU, in the next 2 days, it moved to 110. I'm just giving you an example, but we move it, you know, we doubled it. So.
And
I really like your, please, Mary Joy.
I would also like to address that as a bigger organization through our collaboration with the American Nurses Association. This is where those conversations are elevated, right? And this is where we always try to advocate that it's important for Filipino nurses to belong to PNAA. So this way we could have a bigger voice and escalate it at the higher regard, because these are where conversations happen in terms of like influencing policy as it regards with hazard pay, right? Because that's driven through the state, to the Congress, to the federal government.
Great. And, you know, for those who are listening in, who are not yet members of PNAA, that's an invitation. You can contact Mary Joy and join. Jenny Aying just commented. She said you're a 5,000 strong force. So that's an amazing, you know, a number, and we need more. And Ray, I really am, you know, I really like your emphasis on leadership. And, you know, here in the Philippines, there's a lot of discussion about, you know, in increasing or even instituting mass testing for COVID-19. I think the real mass testing is the mass testing of leadership, right? Yes. And now leaders at all levels and from all walks of life are being tested. Are you going to put in place the necessary investments for your workers, for your families, for your countries? And so it's great to see an amazing array of leaders from both sides, from the Philippines and from the US.
Absolutely.
um, you know, uh, caring for their employees, for their health workers, and I hope that more will step up. There's a question about discrimination, and that also happens a lot. Discrimination towards health workers, in particular, that happens not just in the Philippines but also in the U.S. Maybe of a different nature. In the Philippines now, we hear stories of frontliners, upon their return to their condominium, they're not allowed by the condominium to go to their property, to their apartment, because they're known to be, working in, let's say, a COVID hospital. Meanwhile, in the U.S., we hear news of not just nurses, but people of Asian American ancestry being discriminated upon because we hear leaders calling it the Wuhan or the Chinese virus, and that has led to the stigmatization of the Chinese in particular, but people of Asian American ancestry, including the Filipinos as well. I wonder how Filipino nurses or even the Filipino community in general are addressing racially motivated discrimination as a result of the pandemic.
Hi, Jeff. Hi, it's Mary Joy. Just to share a story, my daughter lives in San Francisco, and obviously another area where there's a lot of Filipino Americans. And she actually texted me and called me, "Mom, make sure that grandma and grandpa doesn't go out of the street because people here are pushing. If you're like Asian looking, you're Chinese looking, they're pushing them down the street." And that's really sad. And I think that's really attest to education and awareness of people. And this is why through the Philippine Consulate and the collaboration with PNA New York and also Kalusugan Coalition, NAFA, they were able to provide this educational awareness session, not only about the COVID-19 series, but the impact of racism in the community and how to address it. There's like a hotline number that people could call, but unless we share this type of information all across our community, then people would be silent about it. And this is where we need to really advocate and increase people's awareness on how to call appropriately when this type of stigma or microaggression happens.
Anyone else who would like to add?
Actually, for me, it kind of levels the playing field because you're wearing a mask, you're wearing a bouffant. They don't know who you are or what what ethnicity you are.
Right.
Give them care and it works.
Thanks, Jeff. Thanks, Jeff. Yeah, we have questions about basically, when we were listening to your presentations and your sharings, COVID-19 has affected us all, but COVID-19's effects are, manifest in different ways. And it depends on, your resources, your assets, right? And obviously, the US is a way more advanced country, center of technological innovation, where the New York Presbyterians and the Stanford hospitals are located. And it just, really highlighted the great divide, between, let's say, the US healthcare system and the Philippine healthcare system. I wonder if you have thoughts with regards to how can we, for instance, how can PNAA forge alliances with the Filipino nurses who are disproportionately affected by the pandemic, low pay, shortage of PPEs, etc. I know PNAA has a very good relationship with the Philippine Nurses Association. Last January, we just had our conference, right, in Boracay, a joint one. And so I wonder, what do you see is the future of, the Filipino and the Filipino-American connection, and how we can, work together towards really pushing for reforms from both sides of the Pacific?
That's a great question, Renzo. Our relationship with PNA Manila has been strong for the past years. In fact, we do every 2 years educational programs there together with the Association of the Deans of the Colleges of the Philippine Nursing. Um, Obviously, we need to really hold arms together and really address what are the commonalities, where are the gaps, and how do we continue to advocate for our nurses wherever they are, because COVID will stay with us for a long time. And in terms of I guess, raising awareness again from our perspective, and at the same time, resources. Some of our chapters have donated masks also to some areas in Bicol and other parts of the region. But obviously, the sustainability of it is not dependent on us. It's also dependent on how do government address these issues globally. How do nations come together? So this way, we're looking at it systematically from a source and supply chain perspective, from a scientific perspective in terms of like the race towards a cure for a vaccine, and at the same time from a resiliency perspective. How do we continue to stay focused in order for us to just survive during these times? The psychological impact to our children, right? One of my best friend, I saw her the posting of her son on Facebook, and he was saying that I've never realized how important my mom and my aunt's jobs are as nurses, and I fear that they might not go back home. That's very impactful, posting something on Facebook. And I think that's where we need to come together in terms of really looking at policies, looking at the educational programs that we have, advocating for fairness in the contracts of our nurses, and working with external agencies to really hone on the strict policy guidelines for our nurses.
Great. Any additional points from the others? I like that call for solidarity. And, you know, COVID-19 has really reminded to us we live in a global society, and especially the Filipinos, a country of migration, as we always describe it in the PMRN, right? A country of diaspora. There are Filipinos, specifically Filipino healthcare workers everywhere. And so we can actually form a global movement that will usher this transformation of healthcare anywhere. You know, it's not just about in the Philippines, but and in the US, but every country of the world. Especially now, we're seeing, and I also like Mary Jo, you highlighted a while ago, the importance of viewing and really remembering that health is a human right. And so I think the nursing profession and the nurses from around the world can really rally around the right to health, and to make sure that this gets realized, not just in the US, not just in the Philippines, but everywhere. And I hope PNAA and PNA and all the nursing communities around the world will work together towards achieving this goal. I think the last question that I have is, and maybe that's in relation to the earlier comments that we gave, about the future of nursing migration. You're the ones who made it in the United States. A lot of the Filipino nurses as well, nursing students are aspiring to go there. But on the other hand, and I think we should be very open in discussing, the issues around healthcare workforce and migration of healthcare workers. The Filipino nurses have been described as the frontliners in New York. There's a documentary that Al Jazeera produced recently. But on the other hand, we're having a shortage of nurses in the Philippines. The Department of Health is struggling to even recruit nurses, again, because of the not so enticing low pace that they're offering. And then you have, on the other hand, for the past 10 or 15 years, the mushrooming of nursing schools. We've overproduced nurses actually here in the Philippines. But unfortunately, because of limited opportunities, a big portion are being leaked into other sectors. Some of them go to the call center industry. And so that, I think, is wasted nursing talent So, what is the future of the nursing workforce and nurse migration from the Philippines to the US and elsewhere? But also the other piece is reverse migration. How can we encourage nurses from other places to also invest in the future of Philippine healthcare? Big question, I know.
Yeah,
So,
we will have the whole night.
indeed.
Well,
Renz,
Okay.
go ahead.
Go
Okay,
ahead.
maybe all of
I'm
you
just
should
gonna,
answer because this
MJ.
is
I
our
just
last.
wanna,
All
I just
of you
wanna
will
say
answer.
something. I'm waiting
Let's
for that
start,
also to
let's start
happen.
from Janet.
Actually, I was waiting for that to happen because I have family still left behind for more than 15 years, still waiting for the immigration and to come to United States, and it taking forever, and losing hope sometimes, and staying in Saudi Arabia just to ensure that to have income, steady income for time being. But I'm also waiting for that when it's gonna happen.
Yeah. Workforce is cyclical, right? So
Right.
there's a lot of
Yeah.
baby boomers who will be retiring, like us here. So we'll be retiring soon, and then a new group of people coming in. Right now, it's the it's not fully open yet, but sooner or later, of course, it will the demand will be greater, and therefore it will open. So just wait. Hopefully it will come in a few years. People will be retiring. Of course, it depends on the finances, because right
Hmm.
now people are not retiring because of again,
Economy.
because of
Yeah.
health insurance. It's not easy. It's not part of the equation here yet, but that's very important. But definitely there will be a time that it will open again. And then when it opens, be very selective where you want to work. Because, and also make sure the contract that you're signing in, you read all the small prints, before you sign things. Because sometimes we are like, okay, because of the economic reason, we just sign, we want to go to the United States. But wait a minute, look at those fine prints, and then talk to people like us from the Philippine Nurse Association of America, and you could consult us, and we'll tell you if that's a great place or not. You have the choice, when you come to the United States. Renz.
Yes. Anyone else? This is
Hi.
your last chance to speak. Mary Joy.
So, from the Philippine Nurses Association of America, we have always advocated for a fair, ethical recruitment of foreign educated nurses, not just Filipinos. And we have worked closely with different agencies here, like the MacArthur Foundation, the Alliance, which is now under this CGFNS, which is the Commission on Foreign Graduate Nursing Schools. And through the efforts of our Office of International Affairs, under the chairmanship of Victoria Navarro, way back in 2014, she had created this paradigm of ethical recruitment in collaboration with POLO, the Philippine Overseas Labor Office, and also working on recommendations that POEA should consider in terms of making a fair and ethical contract for our Filipino nurses. And recently, a memorandum of agreement was signed between CGFNS and PNAA that we could support and also refer nurses to CGFNS so they could look at certified recruiters that has been vetted by this agency. And this way they are aware of what they're going forward with. And at the same time, to Dr. Ray Rivera's point, really look at the fine print and look at the contract. Is this fair for me? Are there default penalties that could jeopardize me if I'm not happy with where I am, right? And at the same time, look at the situation. Where are you going in the United States? New York will be different from North Dakota compared to another state. So the living conditions will be different in terms of cost of living allowance. However, the education component still needs to happen from a pre-departure orientation to a post-departure onboarding process here in the United States. And this is why we always emphasize reach out to Filipino nurse, reach out to PNAA. So this way you are onboarded and at the same time have that environmental awareness of what's really appropriate and fair from a labor perspective.
Thank you, Mary Joy. Last remark I would like to hear from Jean Franco to give a view from the other side. This is where the nurses will come from when we speak of nurse migration in the US. So I wonder, Jean, what are your thoughts?
Yeah, in recent years, the Philippines have had bilateral agreements with migrant receiving countries of nurses, but then I guess these bilateral agreements should incorporate not just the process of recruitment and screening of nurses, but also better working conditions and like yeah, with the pandemic, there should also be provisions on what happens to them in case there's an emergency, there's a war or a conflict. Please, I mean, there was a study before that says that the bilateral agreements on nurses are just for recruitment purposes. A lot are missing in terms of the other components of taking care of migrants when they are already in the migrant receiving countries. And remember, in the Philippines, most nurses are actually in the Middle Eastern countries where uh, migrant receiving countries in these areas are really very much inclined to negotiate with the Philippines because they know that there's a surplus of nurses. So for as long as there's a surplus, people will flock and will accept uh, these jobs no matter what.
But Jane, the other challenge there is that some of these policies have no bite. They don't bite, meaning that they have no compliance with it, has no consequences. So if we have these policies, there should be like consequences if you don't follow it.
Yeah,
And that's the challenge. I want to see a policy change for this bilateral agreement that if you don't comply, there is this consequences. I want to see that happen.
yeah, I agree.
So let's make that happen. And
Yeah.
we are already a bit over time, and it's been a very rich conversation. I think this is just the start of a longer and continuous conversation about the future agenda of health for workforce migration and the global health sector as a whole. And so I hope that, again, this is just the start of a stronger collaboration between PNAA, the nurses communities, the diaspora communities, the Philippine Migration Research Network, which has been in the forefront of really trying to understand the migration phenomenon and, to inform policies that Ray was mentioning a while ago. So we make sure that it's ethical, it's healthy, it's orderly migration, it's dignified migration for all. So thank you again to our panelists and to our reactor, Professor Franco, for this energetic conversation. And thank you again, PMRN, for this opportunity for me to moderate. Back to you, Stella.
Okay. Oops. Wait. Okay. Thank you, Renzo. As we are nearing the end of the webinar, I would really like to thank everyone in the panel, our esteemed speakers, for a very rich, impassioned, and knowledgeable discussion. I'd like to thank Dr. Mary Joy Garcia Dia, Dr. Reynaldo Rivera, Ms. Janet Kuai Kong, and Mr. Jeff Encinas, as well as Jean Franco, for sharing their insights on the topic today. Likewise, I'd also like to thank Dr. Renzo Ginto for having skillfully and passionately moderated our discussion today. We also thank the officers and staff of the Philippine Migration Research Network and the Philippine Social Science Council for making this webinar possible. I would also like to thank our viewers today, especially those who sent questions and comments, for joining this timely and relevant discussion. Let me take this opportunity then to invite everyone to join our network of migration researchers and scholars. PMRN benefits include discounts on PMRN publications and on participation fees in PMRN conferences, fora, symposia, etc. The annual fee is very minimal. It is 500 pesos for members based in the Philippines and $25 for members based outside the Philippines. So for those interested in joining PMRN, the link to the online membership form is shown on the screen. For those who would like to view this webinar again, I understand that there is a conflict in the US because simultaneous with this webinar is the Democratic National Convention. So some people's attentions are divided. So for those who want to view this webinar, a recording will be available shortly on PMRN's Facebook page. Tune into this page also for announcements on future webinars and other PMRN activities. We would like to request everyone to accomplish a brief evaluation form to help us further improve our webinar offerings. As you can see, the link to the evaluation form is flashed on the screen and is posted in the comments section as well. Certificates of attendance will be issued to those who will submit the evaluation form, and the link to this form will be open until 11:59 tonight, Philippine time. Finally, thanks to the staff members behind the scenes, particularly Mr. Miguel Caran, Ms. Patricia Rojas, and Mr. Wilson Villones of PSSC. Thank you once again and have a good day. We look forward to seeing you in our next webinars. Thank you.
Thank you.
Thank you.
Thank you. Bye. Stay safe.
Bye-bye.
Bye.